discussion on this?
Madam Chair, can I ask a question, even though I'm not on the board? I just wanted to make note, so you all knew that these minutes were taken by someone who's not here, and so we put these minutes together from memory, so we really wanted the board to look through these to make sure that there wasn't anything of material that was significant that was missed. We tried to capture everything that happened.
And so as we're working from memory too.
Right, but that's, we figured a collective memory might.
Yeah.
Well, I didn't see anything missing when I read it.
I didn't
Okay.
either.
It looks good to me, from what I remember. So, all in favor of approval of the minutes?
Alright.
Any opposed? Motion carries. First of all, we'd like to introduce our new interim CEO, Cindy Sturgar, who comes to us from Butte and has plenty of years of experience in regards to the health center field. Cindy?
Well, I just want to say I'm excited and eager to get to work with everyone here. I think you've done an outstanding job as a board. It's quite impressive, the work that the board's done, and quite impressive that staff, both at the hospital and at the health center, the folks that are here on the ground doing the work, is pretty impressive. So I'm very eager. There's lots of work to get done, and I'm happy to participate with you all in getting that work done. So in that request, we have a couple things coming up that Michelle will talk about, but I just wanted to note, and that is just changing in schedule because we're hitting the holidays. So the month of November and December are holiday months, and we're going to really need to have some special committee meetings and meetings to kind of really step through some of the tasks that we have at hand. And so I'm hoping that that's going to be, you'll all be available to do that, and we'll try to make those convenient for people.
Thank you. Anything else?
I'll just kind of chime in as we go.
Okay, so first of all, we need to set a special bylaws committee, and we want to be able to meet probably next week. We've got some cleanup stuff on our bylaws that needs to be completed prior to a next board meeting, which hopefully we'll talk about having another one of those in a couple weeks to get those ratified. I need 3 people, at least, to either volunteer. If you don't volunteer, I'm going to appoint you. So Kelly and John. And I'll do it. We want to meet next week sometime, like I said, so
So
we
as
can.
the chair, you should try to have other people do it. You have a lot of other duties. If anyone else, this is going to be a 1-hour meeting. I've already reviewed them. We're going to hop through those, so it's
Lloyd, thank you very much.
great.
And if
That,
we
like
can
I
just get them ahead of time and then.
Oh yeah,
Yeah.
I'll send you.
And like I said, I kind of went through
I'll
too,
get
and there's just a lot of cleanup stuff and getting things that are specific to the hospital versus specific to the health center, and we get those changed. So thank you guys. So get together with Cindy afterwards, and we'll get a date set for that for you guys. Also, as Cindy said, we've got the holidays coming up, and we want to have a couple meetings because we've got a few things, especially for the HRSA stuff that needs to get completed and done expediently. So if we have a meeting, if you guys have your bylaws meeting like next week, and we can have another meeting the following week or shortly thereafter to ratify that, it would be a quick like half-hour meeting. If the 12th or 13th of November looks.
What days of the week is it?
Monday, Tuesday. So Tuesday or Wednesday.
You're right.
Tuesday and Wednesday.
It's okay.
Yeah, that should work.
If you wanted to.
And I will be gone on Tuesday the 12th, so if somebody else, if we had a vice chair, which we're going to have to talk about also, to take over. So does the 13th work for you guys? And like I said, it should be a half-hour meeting.
So it's the will of the board.
thinking about 5.
About 5.
Or later, I mean, anytime after 5 is fine.
And then the 12th would be fine for me that way then.
Oh, okay, yeah,
So,
me too.
Tuesday the 12th?
That makes,
That works.
if it's after,
Well,
if it's after 5, it makes it, I mean, I have to drive from Alberton and back, I don't wanna be here too late.
And hopefully, Richard, that one will just be like a half-hour meeting, because mainly it's gonna be to ratify like the bylaws after and discuss that bylaw stuff, so we can get that completed and any other quick things that we need to be done.
Okay, and you're talking the 12th or the 13th?
The 12th at 5 o'clock.
Okay.
Let me put that in here now, so
Then what about the next regular meeting since,
Yep.
the board Thursdays on Thanksgiving?
yep, that's next. Let me get these in here, otherwise that doesn't happen for me.
Okay, here, you wanna do it here?
Yeah,
I'll send them out to you guys in Outlook, to all the board members, so those of you that use Outlook can just
okay,
adopt them. Does that work?
I do, yeah, that works for me.
And then we'll also send out a notice. So usually, once we have that schedule, we'll mail out a notice to everyone, like Monday, so you have the calendar. We will also email it to everyone, so if you have email, you can put it into your calendars.
And then a full board meeting the next week,
Right, which would
like
be the 21st.
which would be a week earlier. And have that at 1.
Someone from X-ray call 150.
Do you guys want a 1 o'clock meeting or
What
a noon
about a
meeting?
decision at 12?
At 12? It's,
For a lunch meeting, is that not good for you?
No?
One's even a little early, but
Oh.
I can do it. If you guys need me to do
Okay.
it at 1, it's okay.
That's Thursday, the 21st.
Thursday the 21st.
And I have my community foundation meeting for our board in Alberton, but that's at 7, or 7:30.
So
In the evening?
1 would be,
One will be fine.
As long as I'm out of here and back.
we'll have you out of here.
Janet, you can work with 1 o'clock?
Yeah, I can do it.
Okay, 1 o'clock.
Okay. And then in December, 1 meeting, like the weekend, or the week prior to Christmas, like the 19th of December, and again at 1.
Go again, say again.
So the 19th of December,
Okay.
which is the week prior to when we normally have it, and at 1 o'clock. Everybody's good with that? Okay. Do we have to approve those? Motion? No, okay, good. And does that take care of the request for additional board meetings? Perfect. Administrative reports?
We just wanted to make sure that I'm just gonna note some information in the board packet for you guys to take. There's nothing to discuss, because the hope is that the committee structure that we will clearly define in the bylaws committee, that you will have committee meetings happening in November and December as well, and a lot of this will go through committees. So I'm just gonna note, what you have in your packet, which if you look through that, in here, I gave you what I received from Vanessa Briggs, who is our program officer in Washington DC. And it's the last half of your packet, and why I'm noting it for you, it's the biggest part of your packet. So if you look at this part, it looks like this, and it's this thick. So this is their summer report on the first half of their site visit. And a lot of this is stuff you know, and it's not the official report yet, but it will look similar to this. So I'm giving you this because the bylaws, there's some stuff about bylaws in here that we'll be doing. So that's just for you to have. The other part of the packet we will go through is policies and procedures when Bill does his finance report. And then there's the rest of this is finance. So that's the report on, just to note in here. The rest, Bill, it'll be yours. And then innovations update, they're on target. We've had some meetings, we have some more meetings scheduled with innovations next week. And again, the goal is to get the organization aligned so that everything's functioning and that the board is getting the information that the board needs to receive so you can make decisions about everything. So, there's nothing in the packet on that, because we're gonna step through those through what the finance committee needs.
Yeah, one of the things just to note on innovations is when we were going through all the issues with it, we made some specific promises to their steering committee about the oversight that we would provide, which includes us seeing their monthly expenditures, so that does have to be a part of it, so.
Right, and we met with their contracted CFO yesterday. We're waiting for the full financials, and so Bill will address some of that for the finance.
Good.
Okay, report from,
Yeah, I just gave mine, because we're gonna knock this out pretty quick.
okay, finance committee?
Hey, I talked to John Earl, and we don't have any more updated financial information because he's been heavily working on getting everything ready for the auditors, which are supposed to start on the 29th. The auditors are gonna be starting.
29th of this month?
Uh,
Of this month, Monday?
Yeah, this month, they're gonna start on the 29th, coming in to do their field work, so he's been heavily working on that, so he hasn't worked on the current year stuff, information. On the innovation grant, as Cindy said, we met with Candy, the part-time CFO for the innovation grant, and we did get some good information from her, but we haven't got all of the, we're gonna be working on the updates with her to where we get a regular monthly, and we discussed with her that she will be meeting with the finance committee meeting about a week before each board meeting, and bringing us the monthly financial information from now on after we're starting with next board meeting, and that way we'll have monthly financial information from her, and then hopefully we'll be getting information from John Earl until we can get something more in-house to do the financial information. As Cindy said, me and Cindy got together and we worked on several policies that have to do with finance, and but what we will be doing is we will be having a finance committee meeting next week, special one to discuss these policy procedures, but she has them for the whole board so they can kind of see what we're going to be, have the finance committee come back to a recommendation to the board to approve these after we get them all secured through the finance committee meeting. Also, Michelle, we got the report from the I don't know what, from Fred on the innovation grant, on what's, on the money on that, and we will be discussing that at the finance committee meeting also. And then, after our finance committee discusses, I've already talked to Lloyd's the chair of the hospital finance committee. We'll then have a joint meeting with them to discuss it jointly with them, because there's a lot of items that appeared, at least to me, and I've given Lloyd a copy of that report so he can start looking at it. But there's a lot of things to me that cross over between the hospital and the center here, so we will then be having a joint meeting after our finance meeting to discuss that, but between the two of them.
Good. Okay. Anything else on the finance?
No, that's,
Bill, did you wanna address the billing at all?
well, I was gonna let, you thought if you wanted to address, Karen has the billing report for you and a little cover letter that she's put together with it. You wanna do it, you want me to address, I'll address a couple of issues I have with it that, either Cindy or Cindy and me are gonna get with Monite on. One is, if you look at the next page after Karen's letter on it, which has a summary, and for the month of September, it has the current charges. What I'm most concerned about is the pay amount, because this pay amount is $77,000, which in August, it was like $85,000. So it's gone down from August to September, which I'm concerned with that, because if we're supposed to be collecting quite a lot of back billing, that to me, that figure ought to be going up for a while, ought to be a lot higher than it is. So we, Cindy and me, will just need to get with Ida and talk to them, and why are we not seeing an increase in that, is where we're not collecting that back billing that should be collected. So that's really all I have in my looking over the report, that to say about it.
I think the other additional detail is some paperwork that, was lagging in regard to Dr. Pafford's,
Yeah, we do still have that problem. It's
Does
been,
Medicaid, Medicare numbers?
it's been,
Yes.
we have, they still have not got his numbers straight, so he can
apparently
be
they
billed.
do.
They do now?
Medicaid is straight.
Well, they finally got it
So
straight?
they
Okay.
indicated, which is indicated in the email that you have in your packet, that they feel that that resolution will show some
We'll start
improvement.
showing that,
Yeah.
okay. So we already have a little bit of answer on that then.
So let me just tell you, so you know what it's gonna look like next time. So what we're gonna do, and this is the work that's been going on, that you guys as the board have been digging into. So what you will get, when the finance committee meets, what we will start getting is a total financial picture for the organization. Then you will get the detail of innovations, in and out for the month and year to date, and for the community health center, in and out for the month and the date, and year to date. So I just wanted to let you know, I've been working with Bill, but I've also been working with the hospital. And last night I was in quite a panic state, thinking this was like the craziest place to ever come to. And today I feel much better, because I am much clearer on the costs that have been going out. So the contract we have with Stacy for doing our payroll and our accounts receivable, or accounts payable, is very clean. I have the full past years. I have it physically in my hand. I feel a lot better. I have that in my hand, just got it today by 11 o'clock. So that's clear and clean. We have that same clarity on innovations now too. So we have the cost side very clearly. I can see it, I can hold it, and it's auditable. The revenue side, there is no revenue on innovations. So innovations is clean. Our side on revenue is what Bill was talking about. It's like how much money's coming in, and can we make our costs every month, of course, is what we're trying to do, right? So Bill and I spent a few minutes just ballparking it, so I could see if I should really be in panic, or just sort of panic, or where we are in it. It's better, it's not crisis panic. I think once we get this is my goal in November. We will be very clear on our information in finance. That's the goal. 2 goals in November. Bylaws cleanup, getting our committee structure cooking here, and finance. We will be very clear on the information. Doesn't mean then we can do a plan, okay? But we'll be very clear on the information. So you will be getting, at the real board meetings, really good financials starting in November.
And that's the other thing, we'll be, in the finance committee, we'll be talking about a budget, present a budget to the whole board for approval of a budget for the current fiscal year we're in, so.
Hallelujah.
Amen.
John gave us a little preliminary one last month. He gave us a little preliminary budget that he had prepared, but we'll be zoning in on that budget and trying to get a more clear budget that we'll be presenting to the board probably at next board meeting, to approve at least a preliminary budget. That doesn't mean that we'll probably for a while this next year, maybe coming in for amendments to that budget several times throughout the year as we have to, but we'll at least get a pretty decent preliminary budget by the next board meeting.
I just want to comment on these procedures, because these are procedures, we're bringing them to you, but I'm instituting these now, because the auditor will want to make sure that everything comes through a main body, so that I sign off on payroll, I sign off on AP, I sign off on any leases, grants that we've given authority to, so we don't have different circles of things happening. Nothing bad has been happening, we just need to align it so that you go to one office, which is the CEO's, so that you know what's happening. So that's what these policies are. These are procedures that talk about that we follow standard accounting processes, and that payroll, and that your check signing, that's on page 2, that your $10,000 limit. So I just want you all to know that I'm moving forward, putting these into practice, because they're procedures that have to happen, like right now.
With the audit starting on the 29th, that brings a good point that I didn't think about. With the audit starting on the 29th, and us liking to show the auditors these in place, should we go ahead and approve these preliminarily?
Well, I think these are pretty standard, and I would recommend that Bill, you take them through one by one and ask for approval.
Okay.
Can we approve?
And then the finance committee will go over and further,
Yes.
but maybe further refine them a little bit, but like the first one is the general accounting policy procedure, and I'll just let you kind of read it, see if you have any, ask any questions about it. But these are policies that the auditors will want to see in place.
Yes, they will.
No question, I'll move we approve it.
And do we want to wait, just approve all at one time, individually or all at one time?
It's better individually,
Individual.
we're gonna go quick.
Go for it.
John first.
I second.
And Richard. Any discussion? All in favor?
Aye.
Okay, the second one is a payroll policy, and like I said, the main thing that, that, one of the main things that we've added in this policy is that Cindy has to approve and sign off on all payroll.
Just a typographical, the payroll will be processed, not processed.
Should have an ED.
Should need some ED on it.
Okay, to make that
Yeah.
one change.
It is in the second line.
Since this is payroll, what are the, Cindy is out, you designate somebody?
Yeah,
Yeah,
or
and it
designate,
says
so that's
that,
number
yeah.
4,
Or
Yep.
yeah.
a
Just,
CE or their designee.
CEO or designee, and that gives her the
Yep.
authority to designate somebody she knows she's gonna be out.
Yep,
And it does, the process, it doesn't say by what date it will be distributed. It says it will be processed on the 16th, but when will they be distributed?
They're distributed on the 5th, and we didn't say that, but
that's in the employee handbook, so when it's distributed, which is the 5th and the 30th. So,
So it
this
doesn't
is a
need-
procedure
It
that's,
doesn't need to be in here then?
we can put it in there if you'd like.
well, they don't.
But we don't
Policy
need
and
it.
procedures, and you can have a different, you can have it in policy, but then this can
Right.
address to the personnel policy, so it doesn't have to be in there, but we could put it in.
I'm just, I wanted.
As long as it's somewhere that they know when they're.
It's in
if
our
it's in the
employee handbook that we
then
already signed off on.
I think we're all right with
And
that.
when we
Yep.
bring all this in-house, these dates are gonna change anyway. I mean, hopefully, we'll be bringing you a plan of what's gonna happen the first year when we bring all finance in-house. And we'll probably go to a 2-week turnaround on payroll.
I'll move approval with the one typo correction.
Second.
Any discussion? All in favor?
Aye.
Motion carries. Approval of checks and funds transfers?
So I do wanna double check this one, this is, same thing, any of checks have to be signed off by the appropriate supervisor, then but checks with 10,000 or over, require two signatures, and that's the CEO and the board, a board member that's on the signature card. What I'm double checking is this is what I heard you all say, I didn't see this anywhere, so I wanted to make sure I wasn't
No, that's
mishearing anything.
that's how we've had it.
Right, okay,
And-
so we wanna keep how we've had it for the audit, and if we decide we need to change that later on, we sure can, but.
That's fine. And I'll move approval.
Second.
And the next one's on notes and loans.
Just a second, we haven't,
Oh,
Go
we haven't
on.
done that one yet. I'm still reading, sorry.
Oh, sorry. Hey,
I am,
and you did ask for a,
I need the red pen.
That's cool.
Sorry,
We're happy.
And we don't need to define who's the countersign.
would it be anybody that's a check signature person that's on the check signature?
And that's your board members.
okay, I've read now. John and Kelly, you seconded?
No,
Or
Richard.
Richard did?
That was from the Southern Plains.
That's right.
Have a
All in favor?
I have some
Aye.
attitude here.
Motion carries. Okay, the notes and loans policy.
Which is a pretty simple one, and,
Only the board can go put us in debt, that's all this says.
Yep.
No one else can do that, it's the
Yep.
board's job.
And I'll move we approve.
Seconded. Y'all.
Any discussion? All in favor?
Aye.
Okay,
Did you clarify which board?
I'm sorry?
This
Could you
board.
clarify this board?
This is only the health center board meeting,
Yes, I know that,
the
but
policies are only for the health
the
center.
trustees are in charge of all money matters
in the hospital,
Yeah, this is only the
not
health
in the
center.
health center.
This is, yeah,
And we're responsible for all of our money in the health center. So, Leona, what that entails right now is we're a 501c3 nonprofit, so we, at this point in time, have an innovation CMS grant, and we also deliver healthcare services. As part of delivering those healthcare services in an outpatient setting, we receive a 330 HRSA grant. So those are our federal responsibilities. Everything that happens inpatient is a different board.
Credit card policy.
We don't have any credit cards right now, but we need one for ordering, and so you need to have a credit card policy. That this is, so you all know, these policies have already been vetted in another agency, and we've transferred them to be made applicable to us at a community health center.
And
Most organizations I've been the CFO in we did have a, organization credit card because a lot of times it's necessary. Say we had employees that travel, say you have an employee that travel, they don't have their own credit card, and so you have to maybe put some of their reservations on a credit card, and so you need a credit card with some gigantic limit, with some limit for ordering some supplies that you have to order or things like that.
yeah, I don't have any question about it. I carry one for the town for the fire department, and it's closely monitored, of course, but,
You're right.
is there a debit card for the checking account then, or is this a
No.
separate
No.
policy? We're not
It's
gonna
only
have a
credit
debit
card.
card.
Yeah, and we don't want a debit card
You
for
don't-
the checking account, no.
you don't want a card out there that accesses the checking.
We
Yeah.
want something that
No,
has
we
a
don't want that.
credit limit on it and no debit card that you can draw out of the checking account.
Yeah.
Is there any routing through secondary like PayPal or anything else on as far as online purchases if you're ordering supplies and that? Does that need to have a policy in regards to the credit card?
That's a really good question, and we will put that on our to-do list if we need to do it. So far, our suppliers do not pay that way, so that we are only doing medical supplies, you know, that kind of office
So you
supplies,
just keep a credit card on file with them?
as now. But we'll keep that in the back of our mind if it should appear.
It seems to be pretty frequent.
Yeah, it's not that much in healthcare because it's standard ordering, but we'll definitely keep our eyes open.
I will move to approve the credit card policy.
I'll second.
That's the rule of person.
My only is typographical here. His or her card is used for appropriately for, one of the fours needs to be out of there. Either used appropriately for center business or used for appropriate center business. Be used appropriately for center business, so I'll take the
For
first,
appropriately center business, yeah.
yeah, we'll take the
That
first
one.
four out of there, and then I'm okay
Yeah.
with it.
Perfect.
All in favor?
Aye.
Aye. Motion carries.
And
Bank
the last one is the
account
bank account policy.
The bank account policy, this is almost redundant, and we think it exists anyway, that we would never put our accounts in a bank that wasn't a real bank. But what this says, given all the discussion we've had in different places, is we wanted to make sure that the health center's funds were always in a protected financial institution. We just wanted that clearly stated. So, that's all that says.
Yep.
It's usually a given, but we thought we wanted some clarity.
Okay, I'll move to approve this one.
Want to second it, Kelly? I'll second.
Okay. I stepped out of my role there. while I
You
was
snooze, you
on.
lose.
Thank you very much, and we'll get the clear
Kind of
cut.
waited to
All-
this side of the room.
How about all in favor of this one?
Aye.
Okay, motion carries. Thank you. Where are we at now? So we did the clinical policies. What are we gonna do with those ones?
So, is this the clinical policy?
Some of them are.
So these are the ones that were handed out last month.
Not last month, the prior month. We tabled them last month, correct?
Got it.
And I think some of these were changes based on this
These are-
one. I think some of these may change based on,
Yeah, so let's,
Do we wanna table them again, or?
no, these I think we want to go, because this is clinical
quality.
quality.
And I know we need to get going on those.
And you've had these for a while, he said. So, these, as you know, So clinical, again, these are always gone through your clinical staff, your doctors, your nurses that look at this. And these are policies because we're a clinic. In some clinics, they don't even bring this to the board. They bring you a policy that's very generic and then they let the clinical staff do it. Given that you're new, it's good for a board to see these so that you can understand some of the clinical stuff. So I only have one, Holly.
Bill brought his copies for us, and I think the rest, if you look through the stack, I think the rest were tabled based on, there will be recommendations for the site visit that will affect
Okay.
those, both the risk management and the compliance.
So the one issue on your quality assessment PI program is that when we do the bylaws with the board, we may set up, which that's a very effective way, saves people time and all that stuff, is a combined committee. So you have some board members and clinical staff that meet monthly that look at the clinical information. So this is about the program, but we will be coming back to you with some stuff on this. So it's up to you if you want to pass it. All I'm saying is we might want to table this.
And
This one until,
Well, I'm just gonna ask, because I've only been here now, about 18 hours. And so I'd like to take this back through the doc and, to our medical director, and, who's present here, who's done great work on it, but just, we might wanna tweak this a little bit after the bylaws committee, instead of, we can either pass it and then come back and adjust it, it's up to you all.
why don't we table it until after the
Sure,
bylaws
yeah.
then, just so we only approve it once?
We may
this
have
might
one.
display my ignorance, but the acronym UDS,
Uniform data system that's required by the feds, that, what we
So-
tell them is how many
But if you
people we do.
put uniform data system or set
Yes,
here or
it
whatever,
should be
it, then either put, if you're gonna use the acronym later, put it there, or,
it should be defined somewhere. Or
well,
was
it says
defined?
implement
the
the
first
uniform
page,
data set
but
is
we
on the
didn't.
first page, but they doesn't follow through.
And quite frankly, these are really informative, and so once the QI committee, or PI, however we're gonna call it here, is put together, the people that sit on that, you learn a lot of stuff. It's really a cool committee.
Quality stuff is gonna be.
It should, in that, under program components, if you use uniform data set, the UDS, you should put it in parentheses.
Yeah, that's what we just,
Yeah.
that's what I just said.
I love you guys. You are like the best editing board. It's
So,
great.
do we have a motion to table the,
I'll make the motion to table it.
Second.
He was first.
Unless, I'm just gonna refer to the medical director. Do you see any urgency, doctor, to having it passed right away? This is the quality improvement program that they handed out, I think, 2 months ago. You and, yeah, I think you and Regina did it. But I don't think we have any urgency, do we? We're okay to let it go a couple weeks. Okay.
yeah,
So
I'd
we're
rather
okay. I
wait till
just
we go
didn't
through
know if I
bylaws and
missed
stuff, so,
something.
alright, we're good on. All in favor of tabling the quality?
Aye.
Thank you. Motion so carries. Any other policies? That's it?
One, I do have one, I'm asking for a motion that your CEO be allowed, so this isn't a policy, this is just a motion, because it's a point of information. When you work with federal grants, it's all electronic now, and so there's designated roles, and your CEO should be your authorizing official. And so I just wanted to see, and then you have program directors, but they're the ones who can get into the, make reports to the feds. They're the final, it's like the final signature, but it's electronic. So I'd like someone on the board just to make a motion that says the CEO is the authorizing official on all federal grants to be used in the electronic handbook.
I'll make that motion.
And I'll second it.
And Holly, if you got that, that's good. It doesn't need to be a policy because it changes.
Any discussion on that? John, you second.
Yep.
All in favor?
Aye.
Motion so carries.
Thank you.
And, well, Holly and I talked about that already and how to go about getting it there, so we know how to do that, so.
All right, that's, I need to do the minutes.
But we need it in the minutes,
Yeah.
that's Other items, like Leona,
First off, my name is Leona, Leona,
That is my mistake.
and
No,
my
it's probably
last,
mine.
and my
It's
last
probably
name
mine.
is Scotch, Crichton, Crichton.
Cool.
No, and that's probably my mistake too, because I emailed Cindy
I
to
am
make
so
sure you
sorry,
were
but-
on the agenda.
Thank you.
Probably three things. There was quite a few articles in the papers here recently about a salary being paid out of the Innovations Grant that wasn't supposed to. Is any of that going to have to be paid by the clinic?
Well, we do not know yet, because as I said earlier, we're gonna have a joint finance committee between the hospital and the clinic, and we're gonna have a finance committee of the clinic to discuss that report that we just got like 2 days ago from the feds on it. So we'll be discussing all of that as to where it's gonna have to be paid and what's gonna happen with that complete report, not just salaries, but everything else in that report will be discussed in the next couple of weeks.
And the bottom line with that is that if it's something that has to be paid out by the clinic, it's because the individual in question was doing clinic work and it should have been charged to the clinic in the first
Right.
place. So it's not that the clinic's paying something it shouldn't have had to pay. The clinic is paying something that it should have previously paid and the grant paid it instead.
the grant paid it or the hospital paid it versus, so.
Still gotta be paid.
Well, and it
Yeah.
got paid,
It
it
has to
just
be
was
paid.
paid out of the wrong, I mean,
They
it was
were
paid out of
employed.
Innovations where it should have been paid out of the health center.
But the
That's-
money will have to go back to Innovations from somewhere.
So Leona, good question. Once we get clear,
Okay.
We'll have answers.
My other two questions, Dr. Padford's been here since December, and he's still having trouble getting his numbers through for billing?
good question. Right with you.
Thanks, Leona.
And my last one was, I've never gotten a straight answer from either board about how supplies, are they put out on bid?
So are you talking about
For the,
equipment, Leona, or
no,
supplies?
your daily supplies.
Okay.
Uh,
Usually you don't bid anything that's not a significant amount, which
Okay.
is usually over $5,000.
Okay,
And so, I don't know on that,
okay,
but
I would like to know if it's separate from the hospital, as
It is.
someone had a real cozy deal with that at the hospital.
ours is very separate.
Good. Okay, that's all this week, month, whatever.
Thank you.
Thank you, Leona.
And just FYI, so everyone knows, since I'm trying to get, I am going to meet with Leona, so I can get to understand what's been going on here, so, just so people know. I have put a call out to Leona and talked to other people that I thought were in Leona's.
When you call my house and you get a man, you don't have the right number.
Oh, that's what you want us to think.
No, there's a 92-year-old mom and 69-year-old me, and the cat don't answer the phone.
That's almost too much information.
It's okay, Leona, I don't let women answer my phone either.
I
Tell
just
your
have
mother's holding out on you.
a couple,
I guess.
I just have a couple for the good of the order in, things. We have a couple resignation letters that came in. One being from Amy, and I'll read it. It says, Michelle and the Health Center Board, it has been a bumpy ride this last year with the Health Center. The events of this past year have definitely taken its toll. Although I have to say that I have learned a ton in the process, I've thoroughly enjoyed working with all of you. I feel the Health Center has an excellent leadership, and there are great people on the board with the skills needed to make it successful. I strongly believe in the mission of the Health Center and will always be a strong supporter. I've increasingly felt a conflict over the last several months between my role as a Health Center board member and the board chair of the hospital. It's been difficult for me to remain objective, and I'm no longer able to devote the attention to the Health Center that it deserves. That being said, I ask that you accept my resignation from the Health Center Board. I look forward to continue to collaborate with you from the hospital side of things as we both work together to improve the quality of health care to our community.
Was that Amy?
Yes, Amy Harris.
I talked to her this morning and said we weren't accepting it, but
I told her
I
too,
will
but
make a
I mean,
motion.
I understand, and she's
Yeah.
talked about it for a few years, or a
I'll
few
make a motion that we
months,
accept her resignation.
so.
If you add the word reluctantly, I'll second.
So, Richard, did you get it in there before John, or?
Well, his was more eloquent. but-
There we go, okay. Any discussion on that? All in favor? All right,
Reluctant.
motion carries on that one.
I'll against it.
Okay, and, other than that, we need to adjourn to executive session now.
You said you had two
Tuesday.
resignations?
You had two writs.
I had two, we're gonna actually talk about this one in executive.
We're not accepting
We're
the
not
second.
accepting this one, is, so,
The plan was for me to meet Norm Twist this morning, but this particular individual wasn't home when I went, so